1st of May.
Question number 9, the Honourable Maryan Street.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, how much funding for district health boards in the 2011-2012 budget was new money for additional services and cost of living adjustments, and how much was the result of reprioritisation of funding which had been maintained from previous budgets?
The Honourable Tony Ryall.
As stated in the budget release last May, $585 million was made available for new health initiatives, made up of $420 million in new money and around $165 million from savings. We also advised in the budget release last year that of this amount, district health boards received around $400 million, made up of $350 million of new money and an estimated $550 million from the Ministry of Health for population-based contracts. Despite these difficult economic times, the government is determined to protect and grow the public health service.
Sue Moroney.
Supplementary to the Minister. What does he understand to be the reasons for Waikato DHB having to find savings of $20 million in the forthcoming financial year and another $5 million in both of the next 2 financial years?
The Honourable Tony Ryall.
Mr Speaker, all district health boards strive to live within their budgets, and looking for efficiencies really is business as usual, and they're often moving their money around to improve services. And that funding has been increasing year in, year out. In the last 3 years, the Waikato DHB had a funding in the last 3 years of $129 million extra.
Sue Moroney.
Did he provide Waikato DHB with funding to cover their $3.2 million KiwiSaver obligation, which was previously funded centrally by the Crown? And if not, what does he expect the DHB to shed in order to find that money?
The Honourable Tony Ryall.
Mr Speaker, I think the DHB will be expected to meet that obligation in the next financial year. That budget will be announced at an appropriate time. But I have to tell you, the Waikato DHB has a budget in excess of $1 billion. And I am sure that with prudent management of their finances, they will be able to meet those challenges.
The point of order, Sue Moroney.
Order. Mr Speaker, I wish to table 2 documents. The first is a memorandum to the Waikato DHB Board dated the 22nd of February 2012.
From whom?
Chief Executive's report stating that it indicates that savings of about $25 million are required in 2012-13 and a further $5 million in each of the 2 out years.
Leave us sought to table that document. Is there any objection? There is no objection.
The second document then is a memorandum from Craig Climo to all staff of the Waikato District Health Board, in which he states that if the savings cannot be found elsewhere, they would have to come from reducing staff numbers.
Leave us sought to table that document. Is there any objection? There is no objection. The Honourable Maryan Street.
A further supplementary to the Minister. Why is the Hawke's Bay District Health Board having to look at cutting up to 35 jobs, some of which are likely to be frontline services?
The Honourable Tony Ryall.
Well, Mr Speaker, the Hawke's Bay District Health Board in the last 3 years has received an additional $45 million from the government. They are expecting to remain in surplus, but as the Chief Executive said, they're looking at ways that they can make savings so they can balance their budgets and meet important projects in their areas, such as a new health centre in Ryall, new renal and endoscopy suite, improved rheumatology service, a new lecture theatre and a number of other projects. So it's all about providing better services for the people of Hawke's Bay within an increasing budget.
The Honourable Maryan Street.
Thank you, Mr Speaker. To the Minister, can he explain why Auckland District Health Board is reported to be attempting to save $60 million in its budget, and does he think a possible cut of that magnitude might affect frontline services?
The Honourable Tony Ryall.
Mr Speaker, Auckland District Health Board's budget over the last 3 years has increased by $125 million. They will be getting additional money in this year's budget, and I think in response to that question I'd best quote the Chairman, Mr Dr Lester Levy, who with respect to the media reports of those savings said that these service cuts are categorically not on the agenda.
The Honourable Marion Street.
Further supplementary, Mr Speaker. Can the Minister confirm his media release of last budget day when he indicated that there was $420 million worth of new spending for district health boards, when his own ministry had advised him that $576 million was required simply to keep up with cost growth, leaving a shortfall in funding to the district health boards of $156 million, and that any additional services this year will have to be funded from the cutting of existing services?
The Honourable Tony Ryall.
Mr Speaker, that's absolutely consistent with the very first answer that I gave, that we've got $420 million of new money. The additional $165 million came from reprioritisation. That adds up to $585, which is more than the $576 that the member just quoted.
Question number 10, Katrina Shanks.
Thank you, Mr Speaker. To the Minister for Treaty of Waitangi negotiations.